when you go back to the very beginnings, the origins of community as a social concept, the premise is based on the fact that we come together for mutual benefit. We come together to share resources. We come together to have safety in numbers. We come together and we create a construct which is based on fairness, which is based on a balance of systems. What we see right now perceptually in community is there is no balance. There is no fairness in the system.
So if you look at the history of all civilizations, especially some of the bigger, better documented ones going back thousands of years, it's clear that most of these civilizations have failed because of environmental issues, either food security shortages, challenges with toxins in their water supply, or something like that. We tend not to think of it that way. We tend to think of it as a leadership failure or something similar to that. But really the two are connected. The leadership failures are usually the result of not navigating those issues properly.
One of the challenges we face in community is there is a lot of bandwidth for dissension, for disinformation, for people who don't have the time to dig into the situation that they're addressing, but seem to have a lot of capacity to talk about it online, sometimes anonymously, sometimes not.
We're starting to see how society is dissolving, basically fracturing. And that's why it's so important to have nice civil conversations and less polarization.
Many communities, and not just Kamloops, haven't had a vision that it revolves around planning, having a strategic plan to manage those growth. And so within Kamloops, we started a bit slow, and we're trying to catch up. And it makes it challenging at this moment because, population always increases. Inflation affects people's ability to purchase, to rent. And so in Kamloops, we estimate that, for me, anywhere between 5 to 10% of our community is homeless. And that could range from sleeping in a tent, to sleeping in shelters, to couch surfing.
And I think it has gotten worse through COVID.
Mm-hmm.
COVID was hard on everybody. And, that kind of took a lot of compassion out of people at the get-go. We're seeing, as a result of COVID and now kind of economic instability, the grocery prices are rising, housing prices are rising, everything's getting out of hand. I see far more people coming in to the emergency department who have depression, anxiety related to their housing.
People who might have a home, but have to decide between paying their rent or buying groceries. And when people start to experience that, that's some of the factors and the stressors leading to homelessness.
This situation we are in now is not a foot race. We're not in a marathon. We're actually in a chess game. And we need to think in terms of strategy. What can we do around prosecutorial systems? What can we do around criminal code shifts? What can we do around decriminalization and a lack of healthcare to support that decriminalization? What do we do? There's all these pieces. And the challenge is for most people who look at these kind of situations, but for a lot of people who are involved in this conversation, they're like, well, let's just ship them to the island, or let's just ship them to somewhere else, or let's just put them in a camp out of town. But chaos is opportunity in raw form. And so right now what we are seeing is the realization of 30 to 40 years of public policy implementation, which has begun to crumble the system we operate on.
It has to do with a decline in trust in authorities and in expertise.
Canada has even come under international criticism for saying, you have more people in your provincial jails that are not convicted of anything, just detained on remand, about 60%. You have more people there than are actually sentenced on offenses. And this is not good. People are severely impacted in their liberty, their jobs, their ability to support their families, their reputations by being unreasonably and overly detained. We're over-criminalizing the poor, the mentally ill, the vulnerable, and racialized persons and Indigenous persons. And we do have a problem in Canada. 50% of the women prisoners in our federal jails now are Indigenous women, even though Indigenous people are about 5% of our population.
In my opinion, the biggest single barrier is the lack of a robust health system.
We have a crisis as far as the healthcare system. we have a crisis as far as individuals being able to get referred and triaged to see a psychologist, for example, in many communities. And some of those factors we need to address first in order for us to sit down and say, okay, have we exhausted all the other steps we were to take? And the answer is no. The answer as a whole in Canada is that we haven't done that yet.
Do we actually have services that are meaningfully addressing the complexity of problems? And I would say no.
But we need that healthcare, mental health piece tied to it. Mental health is physical health, and physical health is mental health.
There's this desperation. There's this hopelessness and desperation that is much more prevalent now. And I don't think that's just coming from the drugs. I think the drugs are a reflection of the overall situation of hopelessness and desperation that people are feeling now.
In the past, we used to say that if people simply had better information and more information, they would make better decisions, that there was a gap, right? Mm-hmm. And of course, that was true to a certain extent. But now, obviously, there's more information out there than anybody could reasonably absorb.
Stop beating each other up. We have to stop, beating up council, and beating up people who run agencies, and beating up the homeless. And we have to stop beating each other down. And instead, we need to start lifting each other up. We need to find ways, if we have concerns about the way ASK is operated or CMHA is operated, let's go and sit down and talk about those issues and find a path to resolution.
What does healthy communication between people look like?
Looks like what we're doing. It's honest, face-to-face dialogue, true interest in learning about the other person's perspectives, active listening, not being offended by what other people say, being willing to change your opinion when you hear something that maybe makes you think about something differently. Digging your heels in and sticking with what you believe initially isn't necessarily a healthy thing to do.
We have to start working in a more collaborative environment. And that means that when we come to the table, we have to yell less and listen more.